This is the Strengthening People and Revitalizing Kansas Town Hall meeting with Senator Tom Hawk, moderated by Tim Shaffer of the Kansas State University Institute for Civic Discourse and Democracy. This recording includes presentations as well as an open discussion. Presenters include Jason Smith of the Manhattan Chamber of Commerce, Lori Huber of the Clay County Economic Development, Bob Copple from Via Christi Ascension Hospital, Marvin Wade of Manhattan Ogden Public School District, Keith Ascher from Geary County Commission, Sue Peterson from Kansas State University, Ben Foster from Twin Valley Telecommunications, Lonnie Baker from Meadowlark Hills Retirement Community, Usha Reddi, the Mayor of the Manhattan City Commission, and Jerry Mayo, Clay County Commissioner.
If perchance somebody does not get to ask a question or has a question and they'd rather email it to me, my email is tom@tomhawk.com, tom@tomhawk.com. And if you want me to call you back, I'll try to do that probably on Friday. I have a funeral in Colby tomorrow. But and I think we ought to go ahead and start. You have the list that we sent out with the link. So Jason Smith, you're up. Tell us what the Chamber's thinking, and you're also co-chairing a Manhattan task force. So yeah. What are you thinking from the Chamber business perspective?
Well, first of all, Senator, thank you for the opportunity to be here today, and certainly humbled that I would be first. I'm not. Maybe you start with low expectations and move to the higher as we go further. So a couple of things as we were thinking about what to talk about this evening. There was a national article that was printed, and I apologize, I don't remember the publication, but it featured one of our local restaurateurs who mentioned that 80% of their annual business comes during the month of graduation and the 4 months of football season. And so it became very clear to us as we thought about it that one of the things that is so important for our economy in Manhattan is that we have students at Kansas State, and to whatever degree possible, we have a football season. And so obviously we are supportive of whatever supplies and materials that we need as a community, whether it's testing, more PPE, more, whatever it is. Those two items are so critical for our business community to stay, to be able to survive and prosper going forward. One of the things that happened during the shutdown is that we were able to partner with the city on a loan program, and we loaned about money to about 80 businesses, small amounts. But at the same time we did that, we helped them secure funds through the payroll protection program and the disaster loan program through SBA. A lot of businesses were able to survive because of those resources. However, I think in some cases we thought there might be a V recovery. And while there may be a V recovery for some, there's a lot of these businesses that are having a slower recovery because social distancing or to whatever degree is going on. I think the second thing that we would think about is how do we help businesses who maybe are having a more difficult time through the recovery. I think these federal programs were very beneficial, certainly through June and maybe even into the summer, but there could be potential that we get into the fall and we haven't seen the kind of recovery that's necessary for them to get back on their feet. I would remind everybody, PPP and the disaster loan program help cover expenses. They did not replace revenues. And so businesses that rely on spring, think proms, think graduation, think weddings, think a number of different things for I mean, a lot of their income for the year are still deeply impacted. And so whatever degree we can think about opportunities to help these businesses that are probably going to run into some problems in the fall, I think would be great. And then the last thing whatever we can do to maintain, if we hit a spike or a second wave, we think it's very important to put whatever tools are in place to keep as many businesses open as possible. I think another wave of closures will have a much larger impact than the first round did. So,
Thank you very much. Lori Huber with the Clay County Economic Development. Are you on here, Lori?
Yes, sorry, it just took me a minute to find my unmute
There
button.
you are. I saw you even before when you came on.
Yeah.
So, sorry, I should have said hi to you when you came on. I just saw I should have known with the CCED. Go ahead.
Yep. Well, I'll agree with Jason there. A lot of those businesses that are affected, what he was talking about, are the hospitality businesses, and you know, they've lost over 75% of their revenue. So there was the hire grant for the hospitality industry. Early on, it received $5 million of funding, and it was gone like in the first 24 hours or something. I don't know whether those businesses that got in too late and didn't get that funding, whether there would be a way to get that to them, or whether they've already received what they needed through PPP and EIDL and all of those. I don't know, but that's a possibility, is that hire program. Another one with, you know, high income people aren't contributing to the economy as much right now, because the places that they would spend money on, you know, like going to the sporting events and eating out in the motels and things, so they aren't, you know, needing it. They're not putting it back into the economy. And then the people who have been unemployed, they are, you know, they're getting more in unemployment than they might have been getting working, and they're contributing back to the economy. But the ones that aren't getting it are the ones who have continued to work, the frontline workers, the grocery stores workers, the restaurant workers that had substantially reduced hours just doing takeout. If there was some kind of hazard pay that they could get as a bonus, then they can turn around and put that back into the economy some more. And then another one, looking long-term, would be improving internet service in the rural areas. Here in Clay County, we have really great internet in Clay Center, but outside of Clay Center city limits, it's AT&T territory, and they aren't putting in the infrastructure to improve that. So, you know, we set up a lot of places around town that, like college and high school students taking online classes could come into town to access that capability from in town, because they don't have it outside of town.
Great. Thank you.
Yep.
I haven't had to interject yet here. This is a good model, so thanks for the two so far.
Okay, Bob Copple from Via Christi Ascension Hospital. Are you online yet?
Yep. Yeah, I'm here, Tom. Thank you.
There you are.
Well, thanks for asking. I guess I would probably get a little bit more into the weeds. You know, Jason had mentioned the testing capacity. I think that's really key, that we have that available, especially for our vulnerable population, probably on a 2-week interval. So people who are in long-term care facilities, people who are post-oncology, our transplant population. And I think in addition to that, we know even, you know, in our own region, we've had a number of little areas bubble up in the last couple of weeks, just to ensure that whichever county or wherever that occurs, there's an ability to do testing within 24 hours of that particular population. And, you know, we kind of rally and kind of informally are ensuring that that happens right now. But I think it'd be helpful, especially as we look at the rest of the state. They may not have those resources or anybody to rally to them. We're going to probably have to bring that to them. So I think that's a key part. On the back end, the actual running the tests, we are starting to see more capability within the state, but that might be, again, something we can bolster with KDHE or regional hubs to get KDHE testing done. So perhaps a Hayes or a Garden City, Dodge, things like that, to really make sure we've got that capability. Jason's also, specifically mentioned PPE. I think that's key. And again, I believe we should target some of that to schools or education. So both K through 12, and then also our higher education, and basically stockpile that you could, and I guess, one very basic thing would be to have 5 masks available for every student and or staff faculty member at those institutions. So if there is concern that there's an outbreak, we can immediately put stuff in people's hands to help them be safer. And you look across the state, that's actually several million we would have to get. And so, again, there's a problem with that, but this is probably our opportunity, and be very targeted with that. Education is key. I think, we've had some somewhat spotty attempts around the state to do PSAs. Locally, we actually are funding that with donations. And we can't rely on that to be a consistent message across all 105 counties if we're doing this kind of bits and pieces of who can kind of scramble and come up with the ability to do that. And again, the PSAs for us in healthcare really needs to be around a range of topics. Certainly appropriate use of hand hygiene, how to wear a mask, where you need to wear it, the importance of social distancing. But also we have seen in our industry, especially over the last 4 to 5 weeks, a bunch of people who are finally getting healthcare who should not have waited. And we've had bad outcomes because of that. We've had more expensive interventions because of that. So what can we do to make sure we're encouraging people to seek healthcare? It's actually not dangerous to get the healthcare. Don't get healthcare because you're scared of COVID. Other times the other option is somewhat worse. And then I think that, last thing is probably just the nuts and bolts equipment for places like schools. Do they have a UV light so they can clean areas? Do they have other technology that we have actually used in healthcare for years as a way to provide higher level sanitation? And just to make sure that that's available. Again, we have a ton of schools, or just the schools across the state. We're talking hundreds of units, obviously very expensive. We would just encourage us to be thinking about spending some of the money on things like that.
Thanks a lot.
Thank you, Bob. Marvin Wade, Superintendent of Schools in Manhattan.
From the school district standpoint, as we're looking at the multiple scenarios that we're planning for, I appreciate Bob's comments and comments of others that we have to look at those other issues, the mask availability. And I know our nurses are working with Bob and his staff on the availability of those things. But it really, for us, it comes down to, in order to plan for the worst case scenario, which we would look at as being closing schools like we had to do at the end of this current school year, would be $1 million worth of needs in terms of devices and connectivity for students to be able to take advantage of distance learning. That's an equity issue that we have difficulty being able to meet that need right now. That if we had that would allow us to free up the funds to be able to do the PPE, the training for staff, the training for families to be able to do the other things we need. But it's getting those devices that's the issue for us right now. And I think that's really the bottom line for us, would be the ability to do that.
Anything else, Marvin?
No, I could go, I could talk about the Center for Disease Control and their guidelines and the costs that are associated with that. But if we can get the money for the devices, then that's going to free the money up for those other things with the transportation, the cleaning, the social distancing in the classrooms, those other kind of things.
Great, thank you. Keith Ascher from Geary County Commission. Keith?
Yeah, thank you, Senator. You and I had a good conversation this morning, so I ain't going to rehash too much of that. But I think from a county standpoint, I think you and I agree that we need some guidelines of how we're going to disperse this money. We need some criteria. I think our fear is that we do not want to be a clearinghouse per se. Obviously, when people hear the figures you gave earlier, they're going to be beating our door down for that money. And we need to have some kind of guideline of how we're going to process this. The other thing is, we know that we've been tracking and keeping receipts to turn into FEMA for reimbursement, and the amount that we've been told is 75%. We know that's not going to be possible. I mean, we're talking nationwide. This ain't a hurricane, it ain't a flood. So numbers we've been kicking around is we'll be lucky if we get 30 to 40% from FEMA. So in our opinion, it would be that we would probably need to use some of this money to fill that gap. I guess we're in the middle of a budget process, and to dump this in our lap to try and process all this is really a struggle. But I guess in my personal opinion, I'm not speaking for the other commissioners, but in my personal opinion, I think that we need, first of all, need guidelines, and then we need to take some time to process it. And a lot of people have said this already, we don't know what the second wave is going to be like. And so we probably shouldn't just be divvying the money out right now until we know what's down the road, and who knows what that is. But from my standpoint, it would be smarter to bank that money for a while. You and I also talked about, from a county budget standpoint and an auditing standpoint, these would be considered unanticipated revenue funds. So do we need a line item in our budget, or do we have to amend our budget? Those are just some of them. I know Lori talked earlier about some of the hospitality part. I know that our hotels are hurting. Our transient guest tax is down 42%. So tourism is really struggling. I mean, I could go on and on from a county standpoint, but I guess bottom line is we need some guideline.
One thing I want to mention before I forget, at least at the last steering committee and the executive committee meeting, we talked about this 400 million that's going to the counties, that Junction City's getting 6.3 million, and Clay over $1 million, and Riley County 15 million. That's going to have to be spent, and we don't know if it's out the door or encumbered sometime in October, early November, and what's not spent will come back. So trying to make you even more miserable, Keith, just a little more. We're here from the state government. We're here to help you, and we'll tell you what you did wrong after it's over, okay?
Well, and you and I had that conversation from the standpoint of, are we going to be audited on the expenditures of this? Because obviously if we mess up, will the federal government come back and ask for that money back?
We are told yes. So that's the pressure on both the state and you local counties. And we're not sure who's going to be liable. I wish the federal government had some better criteria, but I'll get on to the next speaker. We may want to talk about that later. Sue Peterson from Kansas State University in higher ed. Sue, are you on here?
I'm ready to go, Senator.
Oh, there you are.
Thank you. Thank you for having us, bringing us together tonight, and thank you for your service. I've watched you in 4 meetings in the last 3 days, so I know you're this guy. Very briefly, I thought I might comment. Higher ed received some funding directly from the CARES Act. I see the president of Manhattan Technical College is on here. He knows that. Half of those dollars, we got $12.6 million for Kansas State. Half of those dollars went directly to Pell eligible students, and that was to help them secure broadband materials and computer equipment, what they might need to do online courses for the rest of this past spring semester. The other half of the money, about $6.3 million, will come to the university, and we're spending those dollars on more technology for the summer and fall, partially on housing refunds and other student services for the fall semester for students. So that's about $6 million. The Spark group gave out $26.2 million that the governor had at her disposal. Thank you to K through 12 for not asking for any of the funds. It all went to higher ed. But the offset is that we'll have a corresponding reduction in our state general fund to higher ed to match the $26.2 million. Yesterday, the Spark Committee, thank you again, Senator, and the State Finance Council provided $17 million to state agencies, $637,000 to K-State. Those would have helped us to date purchase software, rent software, purchase scientific equipment, data processing supplies, consumable supplies related to cleaning and sanitizing. Senator, you mentioned briefly the next round of Spark funding to go out, I think, next month. I looked at those 4 categories, and I think those are terrific. I think that offers public-private partnership opportunities. And so I know Jason and all the economic development folks in the meeting will be looking at that. And I think that's important, knowing though that's one-time money, so it's not ongoing expenses. I would say the university, like the state, the county, the city, and our businesses in our communities have significant lost revenue because they don't have customers, we don't offer programs, we don't have people paying for services and programs. So at Kansas State, we have lost dollars related to that as well. We've furloughed 430 employees since May, and that's about a $2.75 million in savings with that. We are in the process, starting the fall semester. We do what Jason Smith asked us to do, and we're going to have school. I think it's a good thing for everybody. I'm looking forward to it. I teach in the fall, so I'm looking forward to it. And Dr. Shaffer probably is too. We're identifying those startup costs for fall. They're going to be significant. And so I don't know if that's an opportunity for Spark or what that might be, but those will be significant dollars. I think north of 10 million or something like that at this time. Still a work in progress. That's it for me. Thank you again, Senator.
Thank you very much, Sue. Appreciate it. We've got Ben Foster here from Twin Valley Communications, and we've had a lot of discussion at our last meeting about broadband. So I hope Ben will talk a little bit about broadband. And we had Lori mention the need for better and more broadband in rural Kansas. So Ben, what can you tell us the needs are, and what clever ideas do you have from a business standpoint?
Thank you, Senator. I'll lower your expectations too. Clever might be a bridge too far for me, but I'll give it a shot here. So yeah, broadband is, I mean, it's something we're obviously passionate about. It's something that, you know, in the midst of the pandemic, thankfully, I think the profile has risen in terms of how important it is to the economy of our state and obviously the nation. It's also a tool. I mean, you really don't want to get too passionate about tools. It's really about the outcomes that those tools deliver. And at least in, you know, kind of the rural part of Kansas, which I'm particularly passionate about, a lot of that has to do with education and healthcare. So one of the things that's been a challenge for us, you know, pre-pandemic, when we start making our cases to policymakers in particular, not you, Senator, but many others, is that it's just not necessary. You know, it is expensive, and so we kind of nibble around the edges and don't really view the real possibilities because we haven't studied the outcomes. So in terms of a longer term type of scenario I'd like to see is, you know, some sort of study where we really are looking at educational outcomes, we're looking at healthcare outcomes, and, you know, where can we study that? And what's the public benefit in terms of reduced tax dollars while still delivering those outcomes to our citizens? How can we reimagine that? What's that look like for, you know, rural Kansas and our ability to maintain the quality of life that we have there? So I'd like to see, you know, some sort of funding for a study to show that we can actually fund broadband much more heavily in our state and still have some paybacks in terms of saved either healthcare dollars or educational dollars while still getting those outcomes. In terms of a shorter term idea, you and I spoke a little bit about this, but there's actually a program called the Rural Digital Opportunity Fund, or RDOF is the acronym. It's the second biggest broadband program in the history of the country. There's going to be about $60 billion allocated over 10 years to areas that have actually have broadband availability that's under the 25 megabit threshold. As Lori said, there's places outside of Clay County and in Riley County and many places across the state that have broadband capability, but 10 meg or anything under 25 is really not usable these days for much more than checking email and surfing on the internet or Amazon. So the feds have done that. One of the things that I think is, there's actually a bill, it's passed the House of Representatives at the federal level, where you can potentially fund, or I guess the government will go ahead and fund, will award you the auction dollars, the incentive dollars up front if you commit to building gigabit speeds. So not just 25 megabits, but gigabit speeds. I'd like to see if the state could potentially match that, so that we're not building 25 megabit, we're actually building gigabit speeds that can provide those outcomes that I was referring to earlier. I think that's my time.
Great, thank you, Ben. Next, we have Lonnie Baker, Meadowlark Hills Retirement Community, and we actually had a lot of discussion today in Legislative Budget Committee about nursing homes and what we need to do in that area. So Lonnie, are you? I don't see you on my screen.
Well, I'm here. I'm sitting in a shadow for some reason.
There you are.
Well, Senator, thank you for
where the shadow lives.
Senator, thank you for allowing me to be here. I appreciate all the hard work you're doing to look out for people in nursing facilities. Obviously, we've been at the forefront for some time here with the COVID-19. Roughly half of the people around the globe that have died from COVID were in care facilities, which is just a staggering number. In the United States currently, the initial numbers are in the 30-some% range. In Canada, it's actually over 80% of individuals that have passed away have been in care facilities. So certainly it's an environment that's pretty challenging for controlling this type, specifically this virus. And I think if anything that we've learned in all of this, it's that if we have people that are COVID positive, we need to make sure that they're not in a nursing facility. And the options for that are pretty slim. The hospitals aren't necessarily in a position where they can handle that number of individuals. And those range from a person that's very symptomatic, at risk, to individuals that are COVID positive and they're showing no symptoms whatsoever, yet we know that they're still infectious, and we'd like to see those individuals have another place to go until they're non-infectious. And so a couple points here that I think are pivotal for us. Number one is the testing issue, certainly as Bob Copple spoke to, is extremely important. We have to have adequate testing, and I will say that these rural nursing homes across Kansas, they can't afford to pay for the amount of testing that may come their way. At $100 a test for a little nursing home out in western Kansas that has a total of 150 people between residents and staff, you're looking at $15,000 per round of testing. And in extended cases, you may see that go on for months, and we don't know how much longer. So figuring out some way that we have the adequate testing available, and that we're covering the cost of that. The next point is that, again, we have to have some place that these residents can go. It's very difficult in nursing facilities that are built to bring people together to create really good isolation. And so my thoughts along those lines, metro areas, I think, are already starting to step up and create these alternate care sites. Throughout western Kansas, though, we have critical access hospitals that most of them have very low census. They're designed for isolation, and they're also struggling. And we've seen closures, and that's a terrible thing to see. It's necessary in those communities. So I think putting some funds behind those critical access hospitals to rebuild the structure that is there and to equip them to care for individuals that are COVID positive, and not just COVID positive that have an acute need, but even the asymptomatic individuals that are diagnosed in a nursing home. And so the last thing that I would say is
Briefly.
the PPE shortage has been, okay, the PPE shortage has been critical. I would suggest that we move forward with trying to build some greater stockpile in the event of the challenges that are ahead of us.
Great points. Thank you very much. Ron Wells is next, and I asked him graciously to let me have his time because we had a lot of conversation today in my meeting. So I'm going to put that last, and I'd like to go on to City Commissioner Usha Reddi.
Thank you, Senator Hawk.
Oh, there you are.
Yeah.
You popped up in the middle of my screen. Thank you.
Yeah, thanks for, first of all, having this town hall this evening. I think this is an extremely important discussion for plenty of reasons, but mainly because of the timeline. So my understanding is if Riley County gets about close to $15 million, we have to try to work on a plan or a resolution for the school districts as well as the cities in that region to also be allocated some, disperse that money. And I'm hoping when we have our city county meeting tomorrow, if the money was given at 194 per person, I hope we look at some kind of formula like that to get it dispersed and to spend it by October. And that's the other deadline we need to meet. I looked at Sedgwick County's plan since they already have 500 million that were given. I'm not sorry, not 500 million, a million, that they already have a plan in place that they're going through some of the guidelines. If we look at social services and as far as our Manhattan Emergency Shelter or Flint Hills Breadbasket, our stabilization center, our mental health units and our recovery spaces, I would like to look back and see what kind of money was involved in that to make sure we itemize that and make sure we take care of it. And then as we plan forward, can we utilize this money where we, stockpiled was mentioned. If we're going to have people wear masks, some of them we just have to give away. We have to have face mask dispensaries or something where people can just go take a mask and put it on, because the strongly suggested, strongly encouraged is not going to work all the time. But if it's right in front of them, they can just take it and wear it. Testing and contact tracing, that's been mentioned. I cannot emphasize enough. That's going to be extremely costly. But right now we are testing predominantly individuals that have symptoms. At some point, we're going to have to start also testing individuals that don't have symptoms that are in the city. Kansas State University is probably already doing that in their athletics, but we need to also do that in our community. I am worried about broadband and bandwidth and software improvements we need to make. Our technology is very old school right now, when we have to start upgrading it quickly. And hopefully there's some kind of contingency in there that if we have a purchasing order before October, that we can still use it. Because of the timeline, we may not be able to get IT and software, everything in place by October. But I want to know if we can have certain purchase orders ready to go so that it's in the time frame that you mentioned. As every other official has spoken to, the loss of revenue has been tremendous, and it has been devastating to our economy and the city of Manhattan and individuals in it. I am concerned about individuals that may not be able to afford testing. And even if they are able to afford testing, if they end up in the hospital, what do they do? If they have to have certain care, what do they do? Where can they go if they don't want to infect their own families? And making sure we have a place where we can rent or pay a lease of some kind so individuals can stay there away from their families, especially now when we have more people traveling between counties and between states. We need to make sure we have a place for all of these people that are going to come back. Kansas State University will have dorms, but we need to make sure we have something also in the city. I'm looking forward to having conversations with our Riley County commissioners, with you, Senator, and I appreciate Trent Armbrust also being part of the Department of Chamber, as well as Lyle Butler being part of the executive committee. I look forward to strong conversations, and the timeline is going to be critical, so it's going to be all hands on deck for the next few months. Thank you for your work, and I really appreciate you doing this evening. I think it's good to have this communication piece among all the stakeholders at one time.
Thank you so much, Mayor. And we have Clay County Commissioner Jerry Mayo. And there
Thank you,
you are.
Senator. I appreciate the opportunity. When this whole pandemic started, my major concern was tax revenues for the county. First and foremost was the payment of property taxes. And then secondly was how it was going to affect our sales tax revenue. Throughout the whole thing, our property tax payments were about on par with previous years. The interesting thing was our sales tax revenue. Historically for the year, we've been down a little bit under 2%, but the months January through May, we were down about 4% in income. But conversely, the use tax, which is online sales tax, is up 64.5%. So we saw those sales move out of the downtown and our local area to online, which impacts businesses, as Jason alluded to and said, it's really affected our businesses, our local businesses dramatically. We have some businesses that have done very, very well. One business owner told me that they wrote a check to the state for sales tax, the biggest one they've ever written. Some stores, some businesses have not done as well. Clay County has a park at Wakefield where people pull their campers and park for the season. Last year, we endured a flood down there for the entire season. So the county has invested about $150 million into the repair of that. And we were about ready to open in March, which is when the camping season begins, when this happened. So we've lost that revenue. And in the months of April and May, we've lost about $100,000 worth of revenue from that endeavor. But my biggest concern right now is our hospital. About 2 or 3 years ago, we went through a big expansion process with our hospital, and we're a critical access care hospital. So right now they're faced with bond and interest payments in the fact that they've had to discontinue a lot of the outpatient, the out doctors, the outside clinic services that they provide and pretty much live on. So they're facing a real cash crunch when it comes to making those payments. They've received funding from CARES Act, but a lot of this has to be used for specific purposes. And at this point, when I talked with our CEO at the hospital today, they weren't sure if they were able to use that for any other things or not, or if that would have to be returned. So I'd like to echo Jason's remarks about getting some assistance to businesses, especially those seasonal businesses. I happen to run one of those seasonal businesses. And like I said, some of them have done very well. Seasonal businesses have not, because spring season is a big time for seasonal businesses, and spring season didn't happen for a lot of them. So that's a concern of mine too. And I think that's pretty much all from Clay County.
Thank you very much, Jerry. I'm going to just share a few things that are generalized for all three of our counties, and hopefully not pick on my county where I live, Riley County. What I've heard among other legislators is while the money that we have available is intended to be used for a wide host of things, we know we have a wide range of needs. And I mentioned the 4 areas that we were looking at in terms of infrastructure, business, economic development, healthcare, and education. There's some concern from the legislators that the counties won't get that money distributed out to the cities where most of the population is in the counties in terms of the need. So I suspect in my 3 counties, there's a desire to do that, but I heard Keith say, how are we supposed to do that? And are we going to be left holding the bag if that money's not spent properly? The same would go, we need to get the money to the businesses, and that's particularly phase 2, but this phase 1, is largely to get out and get it spent. So some concerns. We had a health department proposal today that we didn't fund in my committee, largely because we thought the counties could fund that. And so KDHE was asking for some funds that would go for some of the things you mentioned, PPE, testing, tracing, et cetera, both the people. And the belief was that the health departments could make those applications to the county. So put a little pressure on my county commissioners that are here about how you're going to work with your health department. And that, I think, was a legislative thinking, though we didn't vote on it, that the counties need to be sure and take care of their health departments. They're actually the governance structure for that by state law. Also, in talking to my county, they have not had a work session on it. So I think all county commissioners are a little concerned as individuals to be making policy decisions until you have that conversation with your other commissioners. That's an important conversation to get started, I think. And I will press when we have our steering committee meeting that we need to get some better guidelines, whether we borrow some from Sedgwick County. But I don't think in the political climate we have in Topeka, we will tell you exactly how to do that. But I think some strong suggestions on how you might go about that, I'm hearing my county commissioners say that would be very helpful. We need to know what that process is, and we need to get that big question answered. Does the money have to be spent out the door, or can it be encumbered? And going back to the need everybody says on broadband, you don't very easily lay fiber cable in a week or two. Ben, probably takes you a full month, right, Ben? But there are some real practical dilemmas to some of the things that I think are needs in how we spend that money. So I'm hearing that, and we may have some more questions on that when we get to the open discussion, which is about now. And I think we can go another 10 minutes, and I'm not opposed to going a full 20 minutes over. And if you need to leave, check out. Tim, is that all right with you to go 20 over?
That's fine. Yeah,
we're going 10 over, so we'll go another 20 minutes.
As long as you don't wreck kid bedtime, that's okay.
Okay, I got you.
I live with little kids, so you may hear them as I unmute myself at some point. So let me just say something.
Tell them how to raise their hand. Go ahead.
Yeah. So I was going to just do a couple quick things. I threw in the chat box a few moments ago that if you want to put some questions there, that would be helpful, especially given the time. Just we can capture that, and then we can try to address it. Senator Hawk can. And also the raising your hand function, I see Jim has just done that as well. So the plan here is to have the opportunity, and maybe we'll go to Jim here first, just to unmute yourself, and we'll kind of use that time frame, just the 2 to 3 minutes at max, and I'll try to control that just so we can be as expedient as possible. And if it's for targeted or if it's more general, you want to just raise it that way, and then we'll go to the chat box too.
Can you hear me?
Yes.
Thanks to everybody. And MATC's come through this with less harmful impact than K-State. And I worry about my colleagues because they matter so much to the state and to our region. My biggest concern, Senator Hawk, is how we keep putting out essential workers. One of our big issues, healthcare workers. The State Board of Nursing allowed the nursing programs in the state, the RN and PN programs, to waive clinical experience this spring. We were able to do all of it through simulation and online things to help get those students through and into the workforce. That was not the case with Department of Aging and Disability Services and CNAs in particular. And not just MATC, but a lot of institutions are able to, in the two-year college sector, are able to churn out CNAs, LPNs, RNs, EMTs. But some of the state regulations related to some of the normal training shut it down. And so I think, again, when there's kind of an emergency like this, like the State Board of Nursing, how can we cut through some of the red tape, use simulations, use software, use the robots, if you will, so we can keep churning out the skilled workers, because many of these healthcare institutions, and I'm sure Bob and Lonnie would correct me if I'm wrong, you had people you needed to get into some of those critical areas, you probably could have used some entry-level workers to help pick up the slack in other places. The other thing is essential workers. I can't keep up right now with the demand, like in welding, construction trades, networking technology. It's a great thing. It means the jobs are still there. But that's a key thing to keep in mind for this regional economy are those skilled technical positions that we can churn out. Thank you.
Great, thank you very much. Any responses from presenters?
I would absolutely agree with everything that he just said there. Thank you, Jim. We certainly have seen a downturn in available staff, both nurses, CNAs, CMAs, and as we look at the potential outbreaks that are in front of us, we'll need a lot more staff than we currently have, because you'll have individuals that are sitting at home on isolation, waiting for tests and all those critical things. So I absolutely agree. It's imperative that we keep up with the workforce.
Great, thank you. I'm not seeing any other hands up right now. So maybe I'll just go. Chuck Rice had a few comments talking about broadband, critical access across the state, telemedicine, agriculture, business, education. Then I think the real kind of core question here is, or a statement more so, infrastructure improvement could it create immediate jobs and energy efficiencies? I may be a little bit in line with what was just being said a moment ago. I don't, Chuck, do you have more to say or to add to expand on that?
Yeah, it turns out tomorrow I'm hosting a national cabinet meeting on artificial intelligence in agriculture. And so if we look at innovations, I'm picking on agriculture, but it could be medicine, anything else, that connectivity, rapid connectivity, several people have mentioned the broadband and high internet is really critical. You know, I had students at K-State that they stayed at the Wesley Center because they couldn't go back home to have classes and that. But that means that those businesses out in the state, if we're going to have efficiencies in agriculture, water, we're going to need to have the connectivity, the intelligence to increase those opportunities. And if we're going to be a leader in the state, we need to have that. So things like that would create jobs as far as building, construction, but then might have longer lasting impact. You remember the tobacco settlement that occurred, I don't know how many, couple decades ago or whatever. A lot of those funds were used for that advancement. So that's what I have.
Great, thanks. Kim Zito had a question about, it was a medical question, a theme tonight. Will Medicaid expansion in Kansas help shore up hospitals' balance sheets? Is there any response to that?
I'll give a quick response. We could not get a vote on Medicaid expansion, even though we had a majority of legislators that had indicated they would vote for it. And so this session is over, and I don't think the governor will call another special session. So the likelihood of passing, it's not going to happen this year. It might happen in January again, or be considered in January. I think it would have helped a lot in terms of the hospitals, but I think we're going to have to look at other resources. That train left the station and nobody was on it.
Another question was, can Spark funding be spent on entities such as hospitals that received other government funds, or would that be kind of a duplication of federal benefits?
I don't know, and I'll ask the budget director that question. When we've had our presentations, there's a lot of concern about that. The official doctrine, and somebody else asked a question about you can't use this money to supplant what state funds you would have used otherwise. I think there are still needs, both in our nursing homes and hospitals and our health departments. So I'm hoping the answer to, hope we can get a guideline answer to that. I would hope that we could be clever and figure out a way to do that because I think there are still needs. We just have to make a strong case that it is COVID related. I don't know if I noticed Sydney was on here. I don't know if she has any other legislative information on that she might want to share.
No, I really don't. Am I on? I don't really have anything to add to that tonight. I've just really enjoyed hearing from the vast group of people here about the needs that they see, and I've been very impressed that it's all a lot of similar requests. The needs are similar in almost every area. So good luck, Tom. I'm glad you're on that board. We'll wrestle with it. I do know that we had to return ERA funds after, I can't remember the particulars, but we had to come up with several $1 million after the ERA funding because it wasn't used or wasn't used properly. So those guidelines that you get from the federal government will be very important. And it came to us quite a while later. So it's hard to make that up. So that's just the way it is. Thank you for having me, Tom.
Sure. One thing I might mention relative to these questions, and I noticed there was one on here. I have a 10-page list of federal guidelines. If anybody's interested in that, if you email me, I'll send that to you. It's not fun reading, and it probably will make you more angry than answer your questions in terms of what it means, and we suspect that it will change again. We were told in our meeting, in the initial part of the meeting, you can't use federal funds to match federal funds. That's generally considered the rule. And then somebody said Trump overturned that a couple of days ago and said you could. And then the next day, somebody convinced him that no, you can't. So I think we're going to be in a difficult area with a lot of complexity. We have $50 million in state funds that we put in our budget. The Medicaid expansion money, which was $17.5 million, since we didn't pass that, is sitting over there. And then we had $15 million we put in emergency management. So we have some state dollars. The only problem is our budget is $653 million projected underwater the next year. So we're not eager to spend that, but we spent 25 million of that $50 million today. And some of it went to Department of Commerce because we need to make sure about 5 million, we need to recruit jobs, and we have a lot of companies, interesting enough, that say Kansas looks really good. It doesn't, it's spread out. People are careful. It has a low incidence. We think we'd like to move our business to Kansas. So, but you have to have cash to recruit those businesses. And so there's lots of needs out there. I'm hoping we can give the regents more money. I'm hoping we could get some broadband projects going, and that we could spend a lot of money. And I'm also concerned that we've spent probably about $500 million on unemployment. We have $800 million left in our fund. I think we may need to replenish our unemployment fund, especially if we have a second wave, or at least some of it. So there are lots of things to think about. But overall, I think the ball is in the city and counties courts and the local communities and health departments to figure out how to spend that $400 million that's coming down right now. And I recognize from tonight that you need better guidelines. I'd say look at Sedgwick County. Usha mentioned that they have some guidelines. And if you want to email me, I'll email that link to you too, so that you can look at what they have. And in the meantime, I hope that we can help you out so you can start making some decisions.
I have a couple things. One, I put that your email in the chat box there just for convenience. I know you've mentioned it a couple times tonight, but you can find it there. I'm going to stack a couple questions because they're not directly related, but kind of in the same ballpark, and it might just for efficiency's sake here. One is, what's the possibility of having funds allocated for childcare, especially for those who are cash strapped as they return to work on the job? And then kind of related to this is the sense of funds, the potential for relief of funds for things like EMS RCPD here in Riley County, as well as fire department.
Again, I don't have direct answers. Those are things Spark would need to look at if they wanted to do it, but they may be things that the county commissions could come up with funding some of those things. The child care thing, we had a sidebar conversation at the end of the meeting because, again, particularly as people go back to work, a lot of the child care facilities essentially closed down and may not have the money for startup costs to get going again. So a lot of our younger workers are going to have a hard time going back to work if they have no place to take their children. So I think that's something our Manhattan Recovery Task Force needs to look at, that child care issue. I think we've made some progress on that, but we've also gotten more regulated in the child care business too. The other that we didn't talk about was Big Lakes and what's happening with our ID and DD folks. And a lot of the programs they have been shut down too. So there's probably some need for looking at some of those funds. I guess initially, Keith and Ron and Jerry probably love it. I'm throwing the ball to the counties right now without any guidance, but John Dillinger said, people asked him, why do you rob banks? And he said, that's because that's where the money is. Well, Keith kind of worried about people coming out of the woodwork asking for that money. And I'm sounding like I'm one of the guys in the woodwork, but I'm giving you some ideas that I think you need to have some county commissioner conversations about that initial money. And I think there are going to be needs beyond that the Spark Group needs to look at.
So that Sedgwick County plan is also in the chat box. There's a link. You can find that. John Ford shared that, and I just
good.
copied and pasted that because it didn't quite work right. So it's there. Another question was on Monday. There was a comment about the Spark money possibly being 50% reimbursement and 50% direct aid. Is that what the group ended up deciding by Tuesday?
Good point. Yes, because they realized some counties don't have the cash flow, and so half of that money you can get it up front. You still have to show receipts and spend it by whatever guidelines we give you, but then the other half would be reimbursed, or maybe could be applied for in terms of getting that doled out too once that initial part is spent and justified. But at least half of that money will come out in cash. And I'm not sure when you'll get that, but I think pretty soon.
Senator Hawk.
Yeah, go ahead.
Hi, this is Rich Vargo, Riley County Clerk. How you doing?
Yes, hi, Rich.
Yeah, there's just been a lot of discussion, of course, about Riley County, and I see a lot of people on here from Riley County about what Riley County's preparing to do regarding the funds when we do receive them. Just want everyone to rest assured, Riley County's been talking with Sedgwick County and Johnson County regularly, who we believe is at the forefront. Matter of fact, we already have a proposal for cost recovery and emergency management advisory services from Whit O'Brien's, who is the same group that Sedgwick County has hired. We're very impressed with what Sedgwick County has done. Johnson County is kind of piggybacking off of Sedgwick County. The county councilor has reviewed a contract that we have a budget and planning committee that has been working on this for the past week, and we're going to recommend the board go forward with that agreement. As Senator Hawk stated, these federal regulations are simply just too complicated and changing all the time for our staff to try and interpret. So what we envision is, of course, taking the advice of this company that we're going to hire for their services to recommend how those funds be allocated, because we're going to have to be able to survive a single audit by the federal government. And just like when we went through the 1993 flood, it's nothing Riley County hasn't done before when we stepped up and paid for all of those expenditures throughout our community, regardless of what jurisdiction it was for. So we are on top of it. You guys are getting a precursor, and two of the commissioners are on. We're going to get a precursor to what we were going to tell them tomorrow, and then also at the city-county meeting tomorrow. So we are working on it. We will be prepared, and of course, we will have professional services to assist us in that manner.
I think that's great, and I appreciate those comments, Rich. And I did ask the budget director, Larry Campbell, today, the question that Keith caught me in going into the parking garage this morning, and that is, are you going to have to republish your budget, or can we set that up? And you may have that answer from your consultant, Rich, but I think that's a good question. And the budget director said, wow, we haven't thought about that at the state level. So hopefully some fund would be established so you would not be in a position of having to constantly republish your budget, because there could be 3 chunks of money come out. This that you just got, I'm not sure where phase 2 and phase 3 will go. Not necessarily will that go to counties, but we're not eliminating that possibility yet.
Kim Zito had a hand raised. I don't know if that was just from earlier, since you had asked your question, but if you want, if I have more follow up now would be a time.
Does she want me to mix my metaphors between trains and buses? And is that the question you're referring to, Tim?
Yeah, basically asking if this was to, given the circumstances about the expansion, would this potentially alter that discussion? So maybe you can respond to that just this way of.
Yeah, I love the question, and I wished I wasn't so practical. I don't see the likelihood that the legislature would have to be in session, and I just don't think that's likely to happen. First of all, the people who would vote for it are not in leadership. All the people that are opposed to Medicaid expansion are in leadership, and they are the ones that would have to agree to have that bill cross the floor. So I don't think that's going to happen. I think, unfortunately, while I think it's a great idea, I think we would waste a lot of time dealing with that, and I think we ought to focus on the CARES money. I personally would be very disappointed if Kansas can't get their act together and get, I think we need every cent that we're going to get from the federal government in the CARES Act. And I hope we're disciplined enough and clever enough that we can get it all spent and not have to pay a cent of it back with an audit in the next year, 2, 3, 4, or 5. Rich probably knows how long those audits take, but my guess is it might take them as long as 5 years to catch us if we did something wrong, to send the money back. But I don't want to send any back. I want to spend it right, and I want to spend it all, and I want to help the people in our state. Number 1, their health, and number 2, our businesses, so that they stay open.
Great. So if you remember those principles of civil discourse at the beginning of the evening, that last bullet point was watching this time limit. So we have gone over a little bit, and I think, as Senator Hawk said, if people need to hop off, if there's any last questions, if you want to, you can chat or you can raise your hand. And if that seems too complicated, you could just unmute yourself too, because we seem to be a reasonable group here, but that's not a problem. So any final questions before we call it for the evening?
I have a question.
Yeah.
I just want to say, so once the timeline starts or all of this information comes out, I am very concerned because of the tight timeline that we'll be working under. Even though there is another 2 rounds, if we don't spend money by, is it October 31st, I believe? If we don't spend it by then or have purchase orders and all of that on tag, we return the money. But we would like to have that continuous dialogue. So how do we just email you? Who do we email for constant information? Because I believe even if we have a consultant working on this, getting anything done in local government is hard enough. But when you have that kind of money and you have to spend it within a certain amount of time, it makes it a little bit harder to get all your receipts and everything together.
I would be happy to have you email me initially. I probably will not be able to answer technical questions, but I'll make sure I find the person who can. And hopefully then, as we wade through and start actually taking action steps on dispersing this money and deciding how to do it, hopefully we'll have better information and can move a lot faster in phase 2 and 3. Now, the money's not, if the county doesn't spend it all, it's not necessarily lost to the state. It's just we're going to pick it back up so we could spend it in phase 3. And it may be our safety net is the unemployment fund. I'm not sure about that, but I visited with the budget director about that, and he seemed to think that was a good idea. So it may be we can, but I think there are a lot of other places, and I'm hoping we don't get another surge. And if it is, I hope it's not too bad. But if that's the case, there are going to be other places that money's better spent than the unemployment fund. So I don't want people to just think, well, it doesn't really matter what we do at the county level or the city level. I think we ought to identify our needs and get busy and get that money spent. And I would hope in Riley, Clay, and Geary counties that we're not sending any money back October 31st.
I don't see anything else in the chat box. Any other things that people would just like to say?
Thank you all for a great conversation. I really appreciate it. And we may need to do this again. We'll see how things go over the next 2-3 weeks.
There was a question, just a real quick, before you say your final goodbye, Senator. There was a question about some of the links and things. We have recorded this, so I think we can figure out how the best way to share that if it wants to be or should be. But the links that were in the chat box, the Sedgwick County plan and some other things, there were a couple of Treasury links. I might encourage you right now to just to grab those, kind of click them to save them into your browser before we end, if you want to have them more quickly than waiting for something to be published.
That I assume you were talking to me to click those and save them.
Oh no, I was saying it. I was saying that generally to everybody. I got a couple of comments privately, just asking if they're going to be available. You can too as well, but yeah, I'll also save those, and so we will be able to document this.
If people want to share this recording, how does one do that?
We will. We can figure out fairly easily. I can. This is more housekeeping for everybody, but we can figure out the best platform for you, Senator Hawk. I can just give you a link that will make this available. It won't be a problem.
And again, if you want this recording, if there are people in your organization that might want to listen to it, I'd be happy if you email me to send you that link when I get it.
I'll get it tonight, so we can get that as quickly as possible.
Thank you. Thank you so much, Tim. Great job. I really couldn't have done it without you. And the same way with all the, thank you especially for your prepared and candid remarks. And thanks to everybody who took their time to come listen in on this. This is, as I said, serious business. It's a great opportunity. And I think this is a key part of what it's going to take to lick this pandemic and get us back on our feet as a state.
Well, with that, thanks to Senator Hawk, to the presenters for the comments and the questions, and maybe we'll do this some more. So thanks a lot. I'll keep this up if anybody wants to grab those links, and otherwise you can just click that little leave meeting button and have a great evening.
Thank you.
Thanks, Tim.